Welcome back to part 2 of your chapter 8 lecture. And we left off looking at weight control diet. So we are going to start here at treatment for obesity. So looking at obesity and knowing that the BMI over 30%, or over 30, I'm sorry, is considered obesity. What are some things that might be done to treat obesity? So we want to look at table 8.8 in your textbook, and you can find information there that discusses weight loss medications as well. And then we look at making dietary changes. We look at increasing activity. And also a lot of times there's a reason why a person is choosing to overeat. It might be to make them feel more comfortable and secure. They might go to food when they're feeling sad or down, and there might be things that trigger them to food. We've also seen that sometimes a person wants to, in their life, they don't feel that they can control things, but they feel they control their food. And so there's an abundance of calorie intake there. So this can be, from very easy behavior changes to more difficult ones where therapy and counseling is involved in making these changes. Again, you can look at that table for weight loss medications, and sometimes there are weight loss surgeries or the vagal nerve blockage. So the weight loss surgeries include gastric bypass, laparoscopic adjustable gastric band, or a gastric sleeve. So let's shift gears here now, and let's start talking about some different meal plans for different disorders. So a diabetic eating plan, you would be coaching your patient. The patient would have a diabetes mellitus and need to monitor their carbohydrate intake. The American Diabetes Association encourages the following diabetes meal plans, either the glycemic index approach or the create your plate method, and also carb counting. And you can see more information as far as the details in your book. Looking at a low sodium diet. So sodium is essential to our body because it helps to regulate our fluid balance. And the FDA recommends healthy adults consume no more than 2,300 milligrams of sodium per day. So we're looking at patients who possibly they could have heart disease, they might have high blood pressure, and there are some other reasons that we need to reduce that sodium intake and put them on a low sodium diet. So usually they're referred to a registered dietitian, and this dietitian can then educate and help discuss alternatives for sodium. Sometimes you're also going to be asked to give information to your patient regarding the low sodium diets and kind of help them make an initial plan. So dietary approaches to stop hypertension. You can refer to table 8.9 in your textbook, and this discusses the DASH eating plan, but it is a flexible eating plan. It's recommended for those with hypertension and cardiovascular. And what they want to do here is they want to reduce blood pressure and LDL triglyceride levels. Another diet that we can look at, and you can refer to table 8.10 in your textbook, and this lists adult services for each food group and the healthy diet. So it resembles the DASH plan and the My Plate guidelines. We want to make sure that we decrease our sugary drinks and our sweets and our fats and salts. We make sure to read the labels and select the products with lower sodium, lower sugar. And again, it's best if we can take foods in their natural source. And it's important that we add that physical activity and look at alcohol intake in either in moderation or eliminate. Low protein diets, again, we talked about, or you read about in the book, the body uses protein to repair, to grow, to heal, and it also helps in fighting infections. So we want to look at the protein and how it's broken down. So when protein is broken down in the body, the waste products are eliminated in the urine. And foods with small amounts of protein include vegetables and starch, as well as fruit, sugars, and fats that have trace amounts of protein. So we're going to see people with liver and kidney disease are often prescribed the low protein diet. And so they need to avoid, limit, or restrict foods that contain high amounts of protein. So high amounts of protein can be found in quinoa, nuts, peanut butter, eggs, meats, fish, poultry. And so looking at all of those things in a low protein diet, we give them a list of foods like this to avoid. So looking at high and low fiber diets, the provider may order a low fiber or restricted fiber diet, and this type of diet limits the type of vegetables, grains, and fruits eaten, and limiting fiber and the residue, e.g. like the peels, the nuts, and the seeds, can make the stools smaller and lessen the irritation on the intestinal lining. On the flip side, a provider might also order a high fiber diet, and this diet adds more bulk to the stools. So high fiber diets are used for the following reasons: to reduce constipation and may also reduce the risk of hemorrhoids. It lowers cholesterol levels, it helps control blood glucose levels, and it can also be used for weight loss. Elimination diets or food allergies. A food allergy occurs when the immune system overacts to a protein in the food. Some symptoms may include itching, hives, nausea, vomiting, diarrhea, difficulty breathing, or anaphylaxis. And when people suspect a food allergy, the elimination diet can be used as people remove suspicious foods from their diets. So some common food allergens are listed here. And with an elimination diet, you take those things out and then you kind of journal how you are feeling. And if you see that improvement, then you are thinking that you probably have that allergic reaction to it. And there are different ways of doing this elimination diet, and that would depend on your, again, patient coaching, what the doctor is recommending, and you would be helping the patient to kind of go through and eliminate those foods that might be causing the allergen. So you've probably heard of a gluten-free diet, and this is most commonly used when people have celiac disease. But we find, and even with myself eliminating gluten in my diet, I've found an improvement in inflammation and other things. So it can be helpful not only with celiac disease, but also within seeing if this is one of the things that you need to eliminate from your diet to help with inflammation and intestinal irritation. So where can we find gluten? It's basically in everything. If you read the labels, it's in things that you would never even guess that it's in. But some of the areas, it can definitely be found in barley and malt products, in rye, in triticale, and in wheat. And these are all broad categories, but again, you need to read the food labels and understand where the sources are. And you need to train your patients to do that too. Lactose intolerance diets, and this is if a person's small intestines does not produce enough lactase. The lactose moves into the large intestine, and then the bacteria in the large intestine break down the lactose, causing bloating and cramps, diarrhea, nausea, and even gas. It's important to note that lactose intolerance is not actually an allergy, although we commonly say, oh, I'm allergic to milk or I'm allergic to lactose. Um, and that is, again, because of the process of how the lactose is broken down in the intestines. This would be another diet that you might be teaching patient on. So we know that nutritional needs vary for populations, so we want to make sure we address that. And in 811 of your textbook, it describes the nutritional needs by age groups. So I want you to take a look at that, because that's good to have kind of a general idea of these needs by age groups. And they change throughout our life cycle. Our needs for calories and vitamins and minerals and protein change as we grow and develop. And it also changes depending on if we have any diseases or conditions. And it's important to recognize that there are special dietary needs for those with the various conditions, including pregnancy. They have a different dietary need, epilepsy, HIV and AIDS, as well as cancer and other disease and disorders. So depending on what specialty you're working in, what you are seeing as far as patient education, you can really learn and go in and focus on that. And you'll see that within your office, because it will be something that you'll be doing on a regular basis. But just know and recognize that there are special dietary needs. So the fun part, instructing patients on these changes. So a doctor will give you an order, just like they're giving you an order for any procedure. And this order will be to instruct patient on, whatever dietary changes that need to be made. And you are the person, you are that person that impacts the patient, that gets to sit down with that patient and help them to begin to understand and break down the information, as well as help them begin a plan for themselves. So you want to make sure you walk in there prepared with good, solid information. And so it's your job to collect and gather your brochures and information, and to know the information within before you go in to do a patient coaching or teaching. This means that you're knowledgeable about the content prior. So as you're learning and you're in your office and you find those things that you're instructing on, make sure that you go over information, that you understand it and have done your time and research before trying to teach it. It's just like teaching anything else to a person. And then it's important also to understand why people eat what they do, and understand traditions and culture, and what common foods are being eaten, so that you can, again, help to make sure that you help to make a plan that is doable within their lifestyle. You want to make sure that you show awareness of patient concerns. So again, that therapeutic communication where you're reflecting, restating, paraphrasing, or summarizing information. Also looking at nonverbal behaviors, positioning, being at eye level, making sure that posture is good, because this is an uncomfortable conversation and you're asking them to make some pretty major changes in their life. So you want to show, again, this is showing awareness in understanding the factors, because cost, convenience, background, emotional comfort, and routine are the biggest reasons that people do not complete or comply with their dietary plan that the doctor has been prescribing. So we need to recognize that. Compliance is hard. We can always work with our patients in modifying special foods so that they don't give up. They need to have support from their family, and this can be a transition. It can go, slowly, step by step, so that they can keep this eating plan. Our legal and ethical issues, we need to make sure that we document patient education and dietary changes. It should reflect the doctor's order. It should include general topics and record how the patient's learning was evaluated. So what steps did you take in that communication? And we always want to give patient-centered care. We want to be aware of their cultural diversity, how it affects their diets and traditions. If dietary changes conflict with these practices, it's important to talk to the provider so we can come up with some alternatives. And then referral to registered dietitian may provide the patient with extra support.